first semester nursing student, Nova Southeastern University, here with the president of our chosen nursing specialty group, the American Board of Nursing Specialties, and I'm so honored and privileged to have here with us Dr. Lynne Grief.
Thank you,
I know you're
GQ.
clapping. Okay, so we can't take up too much of Dr. Grief's time on this day, so we're going to ask her just a few questions about our feature national nursing organization, and then we'll let you go and we'll let Dr. Grief go because she has many important things to take care of and many important people. Okay, so first, Dr. Grief, we would just like to ask you to give us a general idea and understanding of the American Board of Nursing Specialties.
Okay, very good. I'm thrilled to be here today. I'm thrilled to meet up with GQ after many years. ABNS is a not-for-profit membership organization, and we focus on promoting specialty nursing certification. We do it to protect you, the nurses, the public, and the patients. So as I was saying to GQ earlier, there are some organizations that promote themselves as certifications, and they really aren't. An example is the IV therapy. There is a specialty nursing organization dedicated to that, but there's also kind of a knockoff certification that nurses mistakenly get roped into, take the exam when they come to their employer with their certificate and say, now can I get my certifications differential? It's not valid. So we want to make sure that people are doing that. We represent over 750,000 registered nurses in the country.
Okay.
So that's
Wow.
important.
That is a big number. Okay, wonderful. Okay, question inquiry 2. We were wondering about some of the tell us about some of the publications and services of the specialty.
So we do that along the lines again of promoting nursing specialty certifications, because the public doesn't understand what it is. Nurses don't understand. I've had nurses tell me that they have a certification because they have ACLS. Well, that's a certificate, not a certification. So that is the big difference. So we really do want to promote what it is and what is the value. Some people have an extrinsic reason and value because they get a differential pay, which is important, but others do it for the intrinsic. It lets them know that they've reached a benchmark, that they've been able to prove to people that they have the knowledge and the experience to pass a pretty rigorous exam. Those exams typically have about a 70% pass rate, so not everybody gets it. And for nurses who have taken an exam and failed it and then finally achieved it, it is a big achievement for them. So we do publish that to make employers aware of it. We want them to support their nurses, to pay for the certification exam, the prep class, and to know that it's important that if a nurse with a certification applies, that nurse is probably a better nurse than the nurse who doesn't have that certification.
Okay, wonderful. And that actually reminds me, when we were discussing all of our specialty groups and interaction in class, we were wondering, is the future of nursing heading in the direction where every department is going to have a certification, or are we there now? Or so how would you?
I think we are moving in that direction, and I'm always impressed when we have our meeting twice a year to see the new certifications that are coming up. And some of them are very small, they're grassroots, but they're coming to our meetings because they want to learn what it takes to become a recognized specialty. Addictions nursing. School nurses, I didn't realize, have a huge certification group. So there's many, of course there's the mainstream like the OR, the ER, ICU, but there are many new nursing specialties that are coming on board, and they too have the wherewithal to do this if they meet the stringent regulations.
Okay, wonderful. Okay, well, I hope this has been informative over and beyond what we have presented today. Dr. Lane, would you like to say anything to Dr. Grief while we're here? Oh, that's right, you can't, so maybe I should turn the other way around. Dr. Grief, would you like to say anything else? Perhaps if I had a nursing cohort who wants to one day become the president of a national organization, maybe 2 or 3 things that they should consider as we look forward to our graduation date in May of 2020 and beyond.
Oh my. You're on a great start getting your bachelor's in nursing. That's what I did. I went from a 4-year program, waited a few years, went right into a master's program in nursing, and then after I swore I would never do it, did a doctorate in nursing. And I think as you go along, it opens up your idea to mentoring, to the professional side of nursing, which is critical. And I would just say keep going, get your certifications, volunteer. That's how I started out writing exam questions for the CEN exam and ended up as the chairperson for 2 years of that organization, and from there moved into the president of ABNS. So just answer the calls when they come to you, never say no to an opportunity, and you never know where your career is going to go.
All right, wonderful. You've heard it from the pro, other than Dr. Lane, pro number 1, pro number 2. Okay, thank you all for joining us. Thank you for allowing me to have this part of our wonderful presentation today on the American Board of Nursing Specialties. Thank you, and we'll see you soon. Okay.
Very good.
Wonderful.